everyone. Good morning, good afternoon, good evening from wherever you're joining. I'm really excited to be able to be part of today's webinar and be part of this amazing team that's going to be presenting about abortion advocates all over the world and how they are persevering in these restrictive environments that we find ourselves. So firstly, I just wanted to take a second to thank everyone for joining, including our panelists, as well as just remind everyone that registration for the 2022 International Conference on Family Planning is open. We're currently accepting registration, so please, if you haven't already registered, please do make your way to the ICFP2022.org site and register. There's more information there about some of our other opportunities that are happening at this time, so please check that out. So without further ado, it is my great pleasure to welcome Beth Schlachter, who is the Interim Director of Global Advocacy and U.S. Representative for the International Planned Parenthood Federation. Previously, Beth was Executive Director of FP 2020, including leading the transition to what we now know as FP 2030, and was a diplomat with the U.S. Department of State, including Senior Advisor for Population Policy. And Beth is also a longtime friend and a member of this community, and so it's with great pleasure that I now hand it over to her and the rest of the IPPF team for this incredible webinar. So thank you, Beth.
Thank you so much, Christina. It's a pleasure to be here with you today. I wanted to start by thanking our audience for joining IPPF and the International Conference on Family Planning to mark International Safe Abortion Day with this webinar discussion with our partners from around the world about their experiences and perspectives regarding persevering against the odds and standing up for abortion rights in restrictive environments. I also want to start by thanking and acknowledging our co-hosts for opening the ICFP platform for this important discussion. We're in partnership today, less than 2 months before the long-awaited in-person family planning conference in Pattaya, Thailand, because we understand that we're all working in an environment with a growing opposition to the entire sexual and reproductive health and rights agenda. This conversation isn't about abortion only being under attack, but what we've seen with the attack on rights in the United States with the fall of the Roe v. Wade constitutional protection for a right to abortion for all people in the United States is a concerted global effort that also has in its sights access to contraception for women, girls, and all people who need it globally. So the conference inviting this conversation a few months out in advance allows us to sort of bring this conversation really fully into the conference itself. Unfortunately, across the globe, hard-won human rights are under threat by a radical right insurgency, a coalition of well-resourced, ultra-conservative, far-right actors working strategically and steadily to roll back progress on gender equality and human rights. They endeavor to deprive children and young people of education about sex, intimate relationships, and protecting themselves from harm. They attack LGBTQI rights. They prevent and ban access to sexual and reproductive health care. And ultimately, they stifle the potential of women, girls, young people, and those of diverse sexualities and gender identities. This opposition coalition unites an array of actors from religious fundamentalists and right-wing populists to conservative media. In the United States, white supremacists and Christian nationalists. There are Russian oligarchs who contribute and other dark, powerful business interests. Their carefully conceived and well-funded strategies have been successful at generating or ramping up sentiment in local communities who are at heart concerned for their futures and the safety and well-being of their children, but swayed by persuasive disinformation tactics as to how this is best achieved. It's a movement that's making some headway with devastating consequences for women and girls living around the world, including in the US and in Europe. And now, buoyed by that US Supreme Court decision to reverse Roe v. Wade and take away 50 years of constitutional protection for the right to abortion, we see swift acceleration into other parts of the world, including Africa, Asia, Latin America, and the Middle East, where the effects can knock out decades of investment in family planning, safe abortion, and girls' empowerment. The attack on Srhr and gender equality is an astute political strategy of populist leaders in their journey toward autocracy. They stoke and leverage public sentiment on Srhr to clamp down on civil society. They design or condone policies and actions that stifle media freedom. They limit the right to freedom of assembly, and they put the safety and security of human rights defenders in jeopardy. Their aim is to hinder robust responses from feminist and women-led movements and organization, where those who fight back face regular harassment and intimidation. All of this has a clear impact on the global consensus that sexual and reproductive health and rights are human rights. Progress in key UN processes and spaces that support actors to drive reform at the national level have been stymied and logjammed in recent years, including in the UN Commission on the Status of Women, the Commission on Population and Development, and the Human Rights Council. What transpires in these global processes is often cascaded down to national level or conversely tested locally before their use in UN spaces. Strategies and tactics, particularly the use of language and framing, are trialed in one space or one country and exported rapidly to another, often tested in Eastern Europe, Latin America, and the US as a prelude to their use in Africa, the Middle East, and Asia, but also originating locally. So the overturning of Roe v. Wade we've seen has had ripple effects far beyond US borders, emboldening those opposed to abortion in other areas of the Srhr and reproductive justice agenda. This webinar will reflect on these setbacks, but also highlight the positive change since Roe v. Wade, including in the US and in other countries. Because we know that while abortion access is heavily restricted in many countries around the world, for legal, policy, social, and practical reasons, for many of our activists and practitioners, confronting harmful norms and providing care in challenging legal settings is a daily reality. But in this webinar, we're going to hear from friends and colleagues, activists, advocates, and practitioners who are working on abortions in restrictive environments and who are making incredible progress. And we're going to hear what lessons we can learn from their work, both for context in the US, but more importantly for around the world. And we're going to hear everybody highlight these positive examples of their work in restrictive settings, showing that even where restrictions are profound, work can be done to advance access to abortion. So now I'm pleased to turn to our first panelist, Pamela Martin Garcia. Pamela is Advocacy and Communications Manager in the Americas and Latin America and the Caribbean for IPPF. She's a feminist activist, and as part of the national campaign on abortion in Argentina, she's participated in advocacy and draft commissions for more than 10 years. Pamela is committed to the work ahead to ensure safe and legal abortion in Latino America. So Pamela, my first question to you is, the Green Wave in Latin America shows the power and influence of grassroots feminist movements, having achieved significant advocacy wins across the region from Colombia to Argentina, Mexico, and Ecuador. What can we learn from the history and strategies of the Green Wave, and what's next for this incredible movement?
Gracias. Thank you, Beth. I will speak in Spanish. Gracias. Gracias, Beth. Es un placer compartir este panel con ustedes. Agradezco la invitación. Y no puedo comenzar sin mencionar, sin expresar mi solidaridad con las mujeres iraníes en este momento. Estamos hablando de autonomía corporal. Estamos hablando de poder decidir sobre nuestros cuerpos. Así que toda mi solidaridad y fuerzas, y decirles que estamos con ellas. Dicho esto, desde este lado del planeta, desde las Américas y el Caribe, llevamos décadas en la lucha por la despenalización y legalización del aborto, ¿no? Y lo hicimos marea verde, esa marea verde que logró despenalizar el aborto en Uruguay, en 10 estados de México, en Argentina, en Colombia recientemente. Y en este paneo de situación también lo hicimos en algunos países en donde tenemos causales y hay restricciones. Tenemos Chile, Ecuador, Bolivia, Brasil, Trinidad y Tobago, Barbados, entre otros. Y en esta región también convivimos con países que prohíben totalmente el aborto, como Nicaragua, República Dominicana, Haití, Jamaica, El Salvador y Honduras. Esta es una vista rápida, y sabemos que las leyes y las políticas no nos garantizan la implementación real. Es decir, alcanzar esa ley o esa despenalización es un nuevo punto de partida para la lucha. Necesitamos entrenamiento para los proveedores de salud, acceso a información pública para que todas las personas conozcan su derecho a decidir, educación sexual integral, y por supuesto necesitamos voluntad política acompañada de financiamiento. Eso necesitamos si queremos una implementación real. Y mientras tanto, ¿qué pasa? ¿Quiénes garantizan esos abortos? Las redes de acompañantes, las colectivas, las compañeras, y también otras organizaciones como nuestras asociaciones miembros de IPPF en la región, con sus clínicas, con su adaptación, proveyendo telemedicina, sus grupos de voluntarios e incidencia política. También están las redes de profesionales por el derecho a decidir en muchos países de esta región. Y por supuesto que hay servicios que brindan excelente servicio justamente de atención al aborto, pero son los menos y no llegan a todas partes. Entonces, los dolores que nos quedan son las libertades que nos faltan. Y en esta región tenemos muchos dolores. Tenemos la pobreza, tiene cara de mujer, la mortalidad materna se ha estancado en su descenso, los matrimonios y las uniones forzadas, 1 de cada 4 niñas se casa menores de 18 años, el embarazo adolescente tenemos la segunda tasa mayor en el mundo de embarazos adolescentes, y por supuesto, lamentablemente, la otra pandemia, la pandemia en la sombra, la violencia de género. Entonces, no obstante eso, desde el sur creamos y construimos esta marea verde, que podía ser arrolladora, pero una marea verde que fue organizada, estratégica, intercultural, intergeneracional, diversa y plural, donde participaron enormemente las juventudes, los movimientos universitarios, con distintas estrategias de comunicación, artísticas, de reuniones, de movilizaciones masivas. Una marea verde que es del sur para el sur, pero que sabemos que también inspira a otros movimientos, y que tiene la capacidad de articular, como decía Beth, en este momento que atraviesa Estados Unidos, de articular con las compañeras de Estados Unidos en esta cruzada oscurantista que derribó Roe versus Wade después de 50 años. Entonces, ¿por qué lo hizo la marea verde? Lo hizo porque siempre la razón frente a los mitos, y la razón era un cambio, era acabar con las relaciones patriarcales, con las relaciones machistas y conservadoras. Y lo logramos. ¿Pero cómo lo logramos? Y con esto termino. Lo hicimos mayormente solas. Lo hicimos en el sentido del financiamiento, lo hicimos solas. Por supuesto que estuvimos acompañadas alrededor del mundo por todas ustedes y por muchos colectivos y movimientos, pero sin financiamiento. Entonces, finalizo diciendo que invertir en los movimientos feministas es libertad y es más derechos. Entonces, esa es mi invitación en este día tan especial, en este 28 de septiembre. Gracias.
Thank you so much, Pamela. I think that's exactly the message that we want to hear, that collectively, together, that we will persevere and that we know what to do in our local communities and among our friends and neighbors. And it's that action together that's going to bring us forward and make that change. That's why I'm excited to introduce our next guest as well, Nelly Municia, who's Executive Director of Reproductive Health Network in Kenya. The network has over 600 trained health providers committed to the provision of sexual and reproductive health information and services including safe and legal abortion services through strategic partnerships, collaborations, and advocacy. Nelly's a trained nurse midwife and a health system strengthening expert, an abortion provider, champion, and an advocate for the rights of women and girls. So Nelly, RHNK, the organization you lead, is at the center of abortion advocacy in Kenya, engaging a wide range of actors from service providers to journalists to build a strong coalition of partners in support of abortion rights. In your experience, how can this kind of movement building be used to manage and mitigate what's an increasingly well-funded opposition movement in Kenya? And what are some of the key successes and learnings from the Kenyan context?
Good morning, good afternoon, and happy International Safe Abortion Day. Taking a moment to celebrate all the brave feminists across the globe that have been at the forefront fighting for the rights of women and girls to ensure that they access safe abortion services. I will start off by just giving a context of the country where we live in, and the country I call home. In Kenya, we have several laws and guidelines and policies. We have the constitution that is very clear in terms of under what circumstances women and girls are supposed to access safe abortion services. We also have the 2012 standards and guidelines that help in the reduction of maternal mortality and morbidity due to unsafe abortion. And then we recently also developed the post-abortion care guidelines. And these are guidelines that help to guide the healthcare providers in terms of how they can provide these services and the training that they have to go through. And then we also have the national guidelines on management of sexual violence, and we have the Health Act and the Sexual Offense Act. So basically those are our pillars in terms of when and under what circumstances women and girls in Kenya can access safe abortion services. However, with all this, we've continued to face challenges. And as you put it, Beth, we've seen the growth in opposition and the pushback. And we have seen a very well-coordinated movement of opposition that have continued to fight not only abortion, but the LGBTQI conversations, LGBTQI folks, comprehensive sexuality education, and also access to contraceptives. We also face a challenge of healthcare providers not being well-trained to provide safe abortion services. In Kenya, we also have contradictory legal framework where you find the penal code saying something else and the Constitution of Kenya saying something else, as I've just highlighted. And then for organizations that have continued to work around abortion, we have not seen a deliberate integration with other sexual and reproductive health issues. For example, integrating abortion in family planning advocacy work, in HIV advocacy work, while all these are sexual and reproductive health issues. Then we have also seen uncoordinated SRH movement, and this speaks to what I've just said. People working, organizations working in silos, organizations working to just tick the donor expectations, while if we worked together, coordinated, then we will be able to deal with some of the challenges that we continue to face. Then we've seen the law enforcers blanketly criminalize abortion and not even leave out situations where women have been raped or women have been defiled. Well, it's very clear that they can access safe abortion services. Then we've also seen our government or our, not seeing political goodwill from the policy makers. And as we know, these are the people that supporting development of progressive policies. If there is a good political goodwill, then we'll have healthcare providers being trained, and we will also even have budgetary allocation for abortion care. So what have we done as an organization, and also bringing just together the sector? In the recent past, we've started what we were calling an intersectoral movement that is able to stand up and speak up for girls and women in this country. And this is because we appreciate that beyond us being health experts, beyond the youth advocates, the feminists, we need the non-traditional actors to be part of the conversation of abortion. Because when we bring in, for example, the researchers, the judiciary, the law enforcers, then we are not going to see a lot of harassment, for example, of the healthcare providers. And then we are training our healthcare providers as advocates, as experts who are able to engage in conversations right from the grassroots where they provide the services, and also engage at the county level with policymakers, and also sit at policy formulation tables as experts at the national level. We've also identified progressive parliamentarians, and we are building their capacity on the legal framework for them to be champions. Remember that all policies start at the parliament. And when we have progressive parliamentarians who have the right information, then it's easy for them to come on board and support our agenda. We also engage at the grassroots through community dialogues, where we brought together intergenerational spokespersons who include the local leaders, religious leaders, women and girls, young people, where we are saying that this is our problem, all of us. Abortion as an issue has to be addressed by everyone. And this is because we want to make sure that we create an enabling environment for women and girls to access services and for healthcare providers to provide the services. Then finally, we are also intentionally disseminating the existing policies and guidelines. And some of the wins that we've had, like for example, the Malindi ruling, which we partnered with the Center for Reproductive Rights, and we had a huge win that is supporting our providers to comfortably provide the services. So we are disseminating some of these fact sheets to make sure that, and some of the rulings to make sure that the community is aware, the law enforcers are aware, and the healthcare providers know under what circumstances they should be providing these services. Back to you, Beth. Thanks.
It's an incredibly complex environment, and I think you've articulated the challenge that we have. But when we break it down and we talk to one another, person to person, and women themselves can speak in their own communities about the realities of their lives, that grounding of that personal experience is always the foundation for change. I think we're experiencing that for the first time, honestly, in the United States as well, where the stigma has to move to the side of this pro-choice, pro-life binary, and women themselves step forward and say it's about the lives and the bodies of women. And that's what I hear reflected in your comments as well, is that's the narrative that can cut through all of those other layers of bureaucracy and policy and contradictory law in order to create that meaningful change. And the partnership and the fellowship that you have in Kenya to do that over a long time is inspiring. And so thank you for joining today, Nelly. And I'm going to turn now to our colleague, Amal Abdallah, who's been working in the NGO sector for more than 2 decades. And she began working with the Palestinian Family Planning and Protection Association from the mid-2006 and has been executive director since 2019. And Amal is steadfast in her support as well of Srhr and providing Srhr services in a protracted humanitarian crisis, reaching particularly vulnerable Palestinian women and girls, and determined that they have their human right to live a life of respect, dignity, and protected from any form of gender-based violence, which we see, as Pamela mentioned, is the hidden epidemic that women around the world are facing. So Amal, we know that criminalizing abortion only serves to make it less safe, and not only limits safe care for women, but it ties the hands of health workers who face significant risk to help women safely into pregnancy. In your experience in a legally restricted context like Palestine, what are the strategies and approaches that can be used to support women faced with unwanted pregnancy?
Thank you, Beth. And I would also like to share my appreciation to have this opportunity to be here in such a significant meeting or webinar. And solidarity to all women today as well, and happy International Safe Abortion Day to everyone. As you said, we are living in a quite legally restricted context. Just to give you a background of, in addition to it being legally restricted, it's also, we're living in a very conservative and religious-based country as well. Legally, abortion is restricted. It's only permitted under the circumstances of a danger to a woman's life. And anybody that would be having an abortion or doing the procedure of abortion or assisting in somebody having an abortion could be sentenced to 1 to 3 years, I believe. So with this context, and also there is the fact that we are a member association of the IPPF, and we do believe strongly in the rights of sexual reproductive health for women. And our service providers are also coming from the context and the legal and the settings that I mentioned before. And this also gives them a bit of a complexity of what they could do, how they could do, and their own cautious of what they're able to do. In addition, I think I should also mention that in Palestine, there's really no statistics or evidence-based of how many women are actually inducing abortions on their own. In 2019, us as the PFPPA, the Palestinian Family Planning and Protection Association, we actually initiated a study in regard to the accessibility of safe abortion services in the country, in cooperation with the Ministry of Health as well. From this, it was like 1,000 women under the age of 55. And it was clear, as you said, although legally restricted, we always know that having these restrictions does not stop women from having abortions. So from the study, the results with the conclusions or the results of the study actually showed or revealed that approximately 7% of the women had known someone or had unsafe abortion. It was done from many different methods, such as lifting heavy objects or ingesting traditional herbs, even detergents at times, jumping from heights and so forth. But this was actually also proving that their abortion is happening one way or another. When a woman decides to end her pregnancy, it will happen. So in addition, another statistic was quite interesting, was that 61% of these women also believe that women are responsible for deciding on if they should continue with their pregnancy or not. 76% of them also believed that women should have access to safe abortion services if under a legal scenario or whatever, the safe abortion services should be accessible to women. So these were all facts that were actually reflecting the actual need to have safe abortion services in the country and to be accessible to all. With us being put in such a situation, the PFPPA decided to actually adapt what we call the harm reduction module, where under such a restricted setting that we're able to provide services pre and post abortion for women. Pre-abortion counseling and consultation services, where our service providers can provide them of the dangers of unsafe abortion, of the legal, where it is permitted, in which circumstances that abortion is permitted. During the abortion, we are not able to provide any kind of support for the women during the process, if they find their own means or whatever. But after, in the post-abortion, we're also able to provide also counseling and consultation in order to try to increase the uptake of family planning methods or contraceptives in order to prevent unwanted pregnancies in the future. So with all this said, this actually gave us, I could say, the ability to provide the maximum that we're able to support women in regard to abortion under such a restricted setting, and also that the service providers as well are protected because they were also afraid of the dangers of assisting any woman in any way, one way or another, in such a restricted setting that they could provide the maximum of able to try to prevent and decrease the number of at least unwanted pregnancies, which of course it's obvious that leads to unsafe abortion in our context. So, and in addition also that this has become an approach that has been actually applicable in the different kinds of settings that we actually provide, if it's through outreach or through the telecounseling and so forth. It was also adaptable through those different kind of approaches. So thank you.
Thank you, Amal. And I think it's an important point that you've raised, that the women, the people who can become pregnant that we're talking about, want to live their lives. They want bodily autonomy, and they will find a way. They can find a way that's safe to them, or they will find a way that resolves the situation they find themselves in so that they can control their future and their destiny. And we as a global community can either make that safe for them, we can understand them, we can work for laws and policies that destigmatize, or we can meet them after the fact and at least provide them access to contraception so that they can determine whether or not they get pregnant again. And I understand that you're working in one of the more restrictive settings. And so that approach of dignity and care for all of your clients and patients is really profound. So thank you for bringing that to us today. Before I turn to our next panelists, I wanted to remind our audience who are with us today that we do have a Q&A function, and we do have about 15 minutes after this round of discussion to answer some of your questions. So please do put them in the Q&A so that we can turn to those in a few minutes. So now it's my pleasure to introduce you to our next panelist, Maravik Bing Parson, who is Executive Director of the Women's Global Network for Reproductive Rights and also leader of the Philippine Safe Abortion Advocacy Network, who are calling for decriminalization of abortion in the Philippines. Bing led the implementation of the Safe Abortion Advocacy Project, which enhanced the abortion advocacy capacity of grassroots organizations to undertake safe abortion advocacy and establish national networks to address abortion stigma at multiple levels. So Bing, with that history, a question for you is around abortion, which is, again, highly criminalized in the Philippines, and recent legal changes that restrict abortion access in countries like the US, China, and Honduras and Iran have highlighted again the importance of collective feminist activism to fight back against these unjust laws. How have the organizations with which you're affiliated used social media and the arts to provide a platform for young people to speak with a united and collective voice and stand up for their rights?
Thank you, Beth. Thank you, everyone. Good evening from Manila. Happy International Safe Abortion Day, everyone. Happy mobilizing. Indeed, abortion in uncertain times is the theme for this year's Safe Abortion Day. And for Filipino women, this is so real. For Filipino women and people who can get pregnant, it has always been a challenge to get abortion services in the country. Providers as well are in uncertain time whether to heed their oath to provide essential health care as they face threat of prosecution or imprisonment and revocation of their medical license. And us as safe abortion advocates also face a lot of stigma and harassments. And this is within our context. And this is also true in the sharing of Nelly and also of Amal earlier. And in our context, it remains a huge irony that even though the Philippines enjoys its rank as the most gender inclusive nation in Asia, but up to date, the country has among the highest number of maternal deaths and also adolescent pregnancies, and has the most restrictive laws on abortion in the world without clear exception, not even to save the life of the woman and the person who can get pregnant. And this has been already mentioned that despite of legal restrictions, many have sought abortion. Many people are seeking abortion. And this also, the COVID-19 has impacted gravely. The COVID-19 lockdown also impacted gravely. People's inability to access the services that millions and millions are actually number of people were seeking abortion during the hard lockdown in the Philippines. And this endangers a lot of people. As I mentioned, 3 women die each day in the Philippines due to unsafe abortion. That's 3 people. And hundreds of thousands are actually hospitalized annually. And 1.2 million were seeking abortion in these very restrictive settings. And so, in despite of these uncertainties, we Filipino activists across generations and sectors persist, we resist and come together to amplify the public call for decriminalization of abortion, there is that strong movement here in the Philippines. We push back by normalizing the conversation around abortion. We also are working with the broad social movements for change and insist that unsafe abortion is also a social justice issue. And it's very, very important that it is being placed in the justice framing. And so, as mentioned by Beth, we are utilizing artivism. So activism utilizing art. With the support of Safe Abortion Action Fund, we recently launched a music album. If you are on Spotify, you can look for it, Pasya, or P-A-S-Y-A, Pasya, or decision. That's a Filipino term for decision. This is to normalize the conversation on abortion. And just to also, say that how effective this is. One of the songs included in that album has been named as one of the best hip hop songs in 2021. So just in this context, and we also do some art workshops. We maximize social media to do our work. We did a Zumba, a party in a public place in a park in Quezon City. That's one of the biggest cities in Metro Manila, dancing to the tune of the songs in that album, in abortion-related songs. So we were dancing in a crowd of 500, 600 women dancing in the early morning of Zumba, talking about bodily autonomy, talking about unsafe abortion, how to prevent unsafe abortion. We also do a lot of visual art, poetry, essays, films to counter the narrative of abortion. And because we think that these are actually, the counter narrative is what we are really needing, because what is pervasive is that abortion is a crime, abortion is wrong. So we have to counter that with the real stories of people, with the real stories of women in the communities that are actually, abortion is happening. No matter how you say it, it is a reality, regardless of what you are actually saying and regardless of the legal restrictions around it. And so, yes. And so what we are actually seeing is that there's that huge intergeneration and intersectional approach going on. And together with the Philippine Safe Abortion Advocacy Network, we launched the Decriminalization of Abortion campaign in the Philippines, where we are saying that, armed with rights-based and social justice framework, that we are demanding the Philippine government to recognize that this penal law right now contributes to the preventable and unnecessary deaths of people. And as of May 28th of this year, we saw that there's that already growing number of Gen Z supporting our online petition for the decriminalization of abortion. And I think the successes of also, the other settings like in the Latin America, as what Pamela has also shared, inspired our work here in the Philippines. The ongoing campaign for the decriminalization of abortion is really informed by the effective strategies of others as well, and that lessons are now being adapted and contextualized in this setting that we are in.
Yeah, thank you. I think that's so powerful, particularly finding ways for this intergenerational solidarity, and that young people whose thinking and mentality hasn't been co-opted by decades of stigma that many of us have lived through, but rather they come at it with fresh experience and a desire for a world that's much more just. And your work to form common cause with those working on social justice, and for those working on social justice to see that living in a woman's body or being a gender diverse person also is a social justice issue, and that we have to form common cause, and we can't work around abortion anymore. We can't just euphemistically refer to it, but it has to be seen as a part of a woman's decision throughout her life, or her reproductive life anyway. And so this creativity of working past that stigma and instead just putting it in your own context for your own life is truly inspiring. And once again, of course, young people will help us lead the way. But wanted to turn next to Marta Lempart. who is a Polish women's rights activist and the founder of the All Poland Women's Strike. And so Marta knows as well as anybody what it means to form collectivist and common cause to fight for a right. She's been active since 2016 in widespread protests against tightening abortion laws under the Conservative Law and Justice Party. And Marta's been targeted by the government with arrests and legal action and faced death threats from opponents of these protests. So Marta, in your lived experience, as opposition attacks on reproductive rights increase, so does the bravery, as we've seen, and resolve of women's rights and abortion activists. And we've seen this to certainly be the case in Poland. As a prominent women's rights activist, what's the role of activism in responding to an anti-women, extreme conservative government agenda in Poland?
I think it's a whole, but I have to explain, I think that we're not that typical, the typical element of this anti-gender fight, because what we started out was already the situation that in many countries, the fundamentalist opposition aimed at. So when it started for us in 2016, the massive movement, we were already within the terms of the abortion ban, because we've had a ban on abortion since 1993.
Sorry, Marta, can I pause you a bit because your sound isn't working well?
Okay.
So it's better when you lean forward.
Okay, because I can also take off my headphones, but let's try that then. Okay. So what happened in 2016 was that the ban that was already established with 3 exceptions, danger to woman's life or health when the pregnancy was a result of a crime, or when the fetus was damaged, it was supposed to be removed from the law. So we would have total ban on abortion. So that's the answer to the question how the massive movement started. The massive movement started not because of some strategical decision. It started in the terms of the ban that we were living at, but when people decided that it's too far. So we were all adjusted to the situation. We all knew how much it costs. We all knew how to arrange that. We all knew everybody knew somebody who's had an abortion, but it was just too far. So this is of course the story of the attack on women's rights, but this is the story of the attack on women's rights in a country when they are already really restricted. So maybe that's what helped in our case, I can say, because that was really, really brutal what was happening back in 2016. And back then, because there's a whole story, the whole establishment, big city, academic, big organization story, how people were protesting for legal abortion in 2016 in Poland. That's not true. That's wishful thinking. People were protesting against further restrictions. I'm in this 40% group that was just adjusted to the ban. That was the reality that we knew. So we were protesting just against further restrictions back then. Legal abortion came after that. So in 2016, we started with 37% support for legal abortion, just 37%. We're now at 70. We're now at 70%. So the thing that happened in Poland, thanks to this horrible attack, to this whole opposition, to this whole scheme that is against us, is actually changing not the law, not the law, but people's perception and people's support to women's rights. Because when we, after the transformation, after the communist fell, we built a democracy that is based on free media, free judiciary, and free elections, and we didn't put human rights anywhere as an important thing. We didn't put women's rights anywhere as an important element of democracy, and we're paying for that now. And the ongoing attempts to ban abortion for many years resulted in this practical ban on abortion that we have now, established in 2020, not via the parliament, but as it was in the US, via politically hijacked constitutional court. So we're back at the judicial independence, democracy, rule of law issue. And what I can say that this is us, of course, that were the protests against the ban on abortion, and then actions for legal abortion that caused this change from 37% to 69%. but it was also collections of signatures, and the fact that we had, even now in June, I presented the bill, the civic bill in the parliament to legalize abortion, because when we collect signatures on the streets, of course we are being attacked, but this is also talking to the people, convincing them, making them feel that they can do something, even if we don't pass that through the parliament. And the result of that, two elements of protests against the further restrictions, so this typical opposition thing, and collecting signatures and giving people actually information that we're not stopping at that. We want legal abortion in Poland. We want many things. We want women's rights in full. Also changed our political scene. Polish political scene is mostly conservative. So also the opposition, the anti-government opposition is also conservative, 90% of them. And they announced back in 2021, the biggest opposition party, which is absolutely conservative party, that they are for legal abortion. They were for the ban. And just recently, the leader of the conservative party, the biggest opposition party, announced that no candidate will be allowed to be on the voting list if they are not, if they don't support legal abortion. This is the win. So the answer to what has activism done in Poland, we did all of this. It's us. It's not politicians. It's not the establishment. It's not some other entities from our. It's international solidarity. It's people protesting on the streets. It's putting civic bills and civic initiatives one after another, and then they follow. So we see that with the political scene of Poland, the conservatives see what the perception in Poland of women's rights is now, and they just have to follow. With the Conservative Party, the support for legal abortion is 97%, 97%. Wow, and with the Radical Catholics Party, it's 94% among the people who vote them. So this is the thing. So I don't want to say that it's all for good, because we're talking about lives wasted, and we're talking about this whole situation of us basically not doing anything else. And we're talking about the system that we are not capable of building fully. We have, of course, abortion in Poland. It's available. Everybody knows number to Abortion Without Borders, the collective that provides abortions. It's the third most known number in Poland after the police and I think fire brigades.
Thank you.
But we cannot prevent people from dying in hospitals. We cannot save them when they clash with medical healthcare system in Poland. So we can provide services out of the system. But when pregnant people enter the system, the healthcare system in Poland, we're helpless. So it's not without the cost. The whole change is not without the cost. And we cannot say, this is good that was this attack, and then we organized, and then the massive movement started, and now we have this society that is new and modern and wants legal abortion, because it comes with this most horrible price in places that we cannot cover as activists, that we have no tools to work as activists. And this is terrifying. This is really scary. And that's why we need legal abortion, in spite of the fact that we can provide abortion in Poland, because the ban on abortion, of course, doesn't mean no abortions. We are perfectly organized. Poland is
that legal context for safety.
Yes. Yes.
Thank you so much, Marta. And you know, it's incredible that where we see women's rights restricted, and particularly in Europe and in the United States, this is a moment of a massive wake-up call, that there's been a complacency and a sense that, particularly within global development, that we're working for women who are over there, who are somewhere else, because our rights are secured. But that's not the world we actually live in. And in Poland, in the United States, and many other countries, we've now woken up to the reality that this misogynist, conservative, oppressive coalition, this mentality is real and it exists everywhere, and that we need to fight in common cause for ourselves in alignment with women around the world, and that we're working for each other, and that's a difference in mentality. And as you said, we don't want pregnant people to suffer, but a silver lining to that is this wake-up call that we need to go beyond even our own ambition with regard to Srhr, and to form common cause for women's goals, for gender diverse people, for everyone to live a life based on realizing their own rights and defining these things for themselves. And that justice mentality is a very different framework than a list of medical services that we want to see available. It's a shift in global mentality. It's a shift in the way we see ourselves in the world and in our global solidarity. And I think it's been a real shakeup. And I'm hoping that that's what can come out of today's conversation as well. And in that note, it's a great time to turn to our next and final panelist, because her organization and her work is providing a path forward for all of us. Veni Alasarua, excuse me if I didn't pronounce your name correctly, is Executive Director of Women on Web. It's an international online abortion service that leverages telemedicine to meet the needs of people seeking abortion. And the service uses the internet and digital technologies to break barriers to abortion and publishes research that has informed the medical profession and helped mainstream telemedicine abortion care. So Veni, while the criminalization of abortion creates significant barriers to abortion care, the effectiveness and safety of self-managed medical abortion and the advent of telemedicine is transforming abortion access and putting abortion directly in the hands of women. How is Women on Web using telemedicine to expand access to abortion? And what more needs to be done to fully capitalize on the opportunities telemedicine abortion brings to all of us? Over to you, Veni.
Thank you, Beth, for the question and introductions, and happy Safe Abortion Day from Montreal. Just before I go to the question, I also want to just express how excited and honored I am to be part of this panel today. As Beth described in her introduction, Women on Web is an international online telemedicine abortion service. We've been now operating for nearly 17 years, and during this time, we have supported people with over 100,000 safe medical abortion services via our website, and we've been answering over 1 million messages coming from around the world. Women on Web is a team of help desk members, researchers, doctors, advocates, digital rights advocates specifically, and we're all motivated first and foremost by a belief in bodily autonomy, but also a belief in social and digital innovations that can expand access to abortions. Because we've been working almost exclusively online, operating an online abortion service, we've been able to reach a large number of people at once. And not just high numbers, but this has also included people who have been traditionally excluded from accessing services because of social or cultural norms or legal restrictions. And I don't want to overlook the difficulties of introducing technology in certain contexts, but we have also been in some instances able to bring our service to more remote places, to close societies with our telemedicine service. Because we've been working online, and working online has enabled us to also challenge the dynamics between providers and patients, putting the information, putting the abortion pills, like they said, directly into the hands of women, allowing us to sort of start rethinking the role of providers and how they can support instead of supervise. Telemedicine has also helped us to sort of start shifting the perception around safe abortions. Abortions don't need to take place under direct supervision of doctors. They can also take place in the safety and privacy of our own homes. And in the same way, abortions no longer need institutional legal frameworks to be safe either. Women on Web started our service working primarily in restricted contexts. So telemedicine for us was a way to establish access when there was no access at all, or where access was very restricted. But what we're seeing right now is that more and more people are coming to us, not from a place of disempowerment, so from a place of no access at all. We're seeing more and more people coming and reaching out to us from a place of empowerment. So expressing a strong preference for telemedicine and online services because of the increased privacy, anonymity, reduced need to schedule travel and have physical contact is something that people prefer. And of course, all of this was extremely relevant in the height of the pandemic, for example. But for us to really capitalize on digital services, telemedicine, that do have a transformative potential on abortion access, we do also need to recognize the limitations of technology. There are significant digital divides across countries and within countries, and digital services are not alone a silver bullet to solve abortion access around the world, especially in places where there's limited internet connectivity, or varied levels of digital literacy. I think it's also really important for us to understand that internet is not this democratic utopia that everybody has access to, where all of us, we can freely produce and disseminate and receive information. Just like abortion rights are under attack offline, they can be also attacked online. And criminalizing abortion, introducing restrictions and bans is not the only way to stop abortions. In the same way, censoring, limiting, or deliberately confusing information around abortion can have a very devastating impact on abortion access too. It can delay access to care, and it can also disrupt access altogether. So therefore, besides setting up these reliable delivery systems like telemedicine, we also need to actively maintain and protect access to information as well. Because access to information is extremely powerful. Internet has become one of the main sources for sexual and reproductive health information and services right now. That's where people are learning about the abortion pill, the telemedicine, all these creative workarounds that activists are coming up around the world to maintain access to abortions. And that's the sort of the new battleground for abortion attacks as well. And lastly, and just to really tie my answer back to telemedicine as well, it has been extremely exciting to see in the last couple of years how countries like the UK, Ireland, France, New Zealand, and others have been adopting telemedicine. But there are still significant regulatory barriers around the world stopping countries from really truly adopting telemedicine and making it a permanent part of their healthcare. For example, here in Quebec, where I'm based, it was only in July when the College of Physicians finally announced that doctors don't need to perform ultrasounds to prescribe the abortion pill. And I think we still also need to make that full shift from thinking that telemedicine is more than just a response to a pandemic or a global emergency. It is simply something that people need, something that people prefer, and it's not a way to just safeguard access or advocate for access, but it's actually a way to improve access altogether as well.
Yeah.
Thank you.
Thank you so much, Benny. I think that your point around the range of people who are using telemedicine and how that got normalized during the pandemic is one of those areas that we can all lean into in terms of the way services are provided and who has access. And this shift in mindset as well, that self-managed abortion is something that women can do safely when they know in the early stages of their pregnancy that they would like to move beyond that and to have an abortion, and they can do so safely and with privacy and without stigma. And there's a huge shift in mentality from that as well. And then looking at the legal and policy frameworks that we're fighting through. So we have a few questions. I want to encourage our audience to add more. But the first ones are really around what we would, I guess, call winning narratives. And that's, how do you frame your advocacy in order to be understood by people in your community, by other feminists, other networks, other ways of reaching out? And so I'm going to ask a couple of you to maybe step forward in terms of how it is that you use, how do you frame advocacy around access to abortion so it's values-based and that people are looking at the lives of women and you meet them at that point. And I'm wondering, Nelly and Bing, if I can turn to you first to share some of your perspectives and some of the ways that you've successfully navigated that.
Shall I go first? Yeah. Here, what we are also, the winning narrative for us really is that the narrative of the people themselves. And these are I mentioned earlier that we have that activism about making poetries around telling truer stories. It's not that our stories are not real and not true, but we are just saying that these are the real stories that have been kept in silence for so long that we have to, to bring it out in the open, that we have to talk about in this context that I am in. Even talking about saying about the word abortion is not actually very much encouraged. Even, saying that word, the word abortion in itself actually has the chills in the nape of other people. But our winning narrative is that people are talking about it. maybe they're not coming out in the open. Maybe there's a cloak of, you know, being anonymous in their narrative, because it is, you cannot come out in the open in the Philippines, say I've had an abortion, because you can actually go to jail up to 6 years because of, you know, having one. And this is the context that we are in. But the narrative that saying really that it is happening, that it is about the bodies of people, it is about, you know, the communities, it is about the social impacts of it. It is about social justice issues, because access is about social justice issues. So yeah, and this has been, you know, attracting a lot of conversations. And today we had an in-person event where majority of the audience are actually coming out from urban poor communities, talking about their own abortion, talking about the experiences of unsafe abortion in the urban communities.
Thank you so much. Nelly, do you want to add?
Yeah. So and I think when we think about advocacy and how do we even package the advocacy information, I think in Kenya is about contextualizing it to different communities, for example. And what we've done at RHNK is having what we call intergenerational spokespeople who are able to reach out to huge number of people at different levels. And then we also allow humanistic stories where women and girls that have suffered, for example, unsafe abortion to come out and share the stories. We could bar their faces, or we could allow, for those that are bold enough, they're able to, you know, tell their stories during dialogues, during international, you know, like International Safe Abortion Days. And this is purposely for you to put a human face on a story, so that we are not reporting, but saying that this is my story, I own this story. And also we use our network providers that have attended to, you know, cases of complicated and unsafe abortion cases, and they are able to tell their experiences. We bring together providers in what we call the provider share workshops, and they're able to tell their horrible experiences with cases of patients who went through what we call quacks in Kenya, the unskilled providers that provide services, you know. And through this, we are able to, you know, provide just an environment where safe abortion conversations continue. And as a result, we are able to deal with stigma and create enabling environment for women to access services and providers to provide the services.
It's great insights. Thank you so much. I'm going to turn now to Pame, and then we'll go Marta, Veni, and Amal. And Marta, when you speak, maybe you could take your headphones out and we could try a different way to see if the sound improves. So Pame, over to you.
Gracias. Again, I will speak in Spanish. Sí, en línea con lo que decía Naredic y Nelly, ¿no? Este foco en la justicia social y en dar voz a las protagonistas y los protagonistas, ¿no? Y que sea intergeneracional y que se escuchen esas historias, ponerle como cuerpo, ponerle esa realidad a las historias. Recuerdo que en Argentina 15 años atrás, 20 años atrás, nosotros hablábamos de mortalidad materna, no decíamos la palabra aborto. Fuimos construyendo un camino hasta que empezamos a hablar de aborto, de interrupción voluntaria del embarazo, y para nosotras la narrativa más fuerte que utilizamos es que el aborto es una deuda de la democracia, ¿no? Como una de las tantas narrativas que utilizamos, como el aborto es salud, el aborto es justicia social, es justicia sexual y reproductiva. Pero el tema de fortalecer las narrativas, de poner voz, e incluso poner voz a aquellas que ya no están, porque el aborto inseguro ha cobrado su vida, y entonces contar esas historias y materializarlas es una parte fundamental para la construcción de la lucha y de este camino hacia el aborto legal y seguro.
I think that's really powerful, Pamela. Thank you for sharing that. For too long, we shied away from talking about abortion, from saying the word out loud and asking for exactly what we want and why we need it. And I think that you're right, that we owe it to all of those people who aren't with us anymore because of unsafe abortion to continue to be inspired by that. So Marta, over to you, please.
Okay, so I think we had 3 elements and we still have 3 elements. One element that we had the success story in the beginning. So we're lucky with the win in 2016 when we managed to stop the government from imposing the ban on abortion. And it was the first action that stopped this government from doing anything. They've been doing whatever they wanted for a year when they took power. And then it was so we have this legend of women stopping the evil government. So that's the thing that we're revamping. The second thing is, of course, the Latin America, the Argentinian, the whole green wave legal abortion thing, because it's us actually who introduced the name legal abortion in this mainstream context. And you can see, I think, the poster behind me. So we did this at the same time when abortion was being decided for the 8th time in Argentinian Senate, actually. And we built on this, so we kind of we cooperated with the sisters from Latin America, especially as the mental state of the society is very similar, the church is very strong. So we had this similar narratives in spite of the fact that it was, that we're not bordering countries. And it actually came to a result in 2020 when we might say we lost the fight against the ban on abortion with the Constitutional Court, but it was the same time when we were protesting, abortion was legalized in Argentina. So it was like, okay, let's see, you see, and we have this example of this long road, things happening. So the success, that's why I always say about positive things, because the success story is there. And we also, but I don't think it applies everywhere, but we use this kind of heavy military narratives, strong words. We curse a lot, and we use the simple language, as simple as it's possible. And we weren't talking about women's rights, right to the body autonomy. We were talking that when we were collecting signatures, that everybody knows how much it costs. Everybody knows how to get an abortion, and everybody knows somebody who's had an abortion. It's really hard to say no to that. So we actually managed to catch some right-wing politicians or some establishment journalists saying like they know how much abortion costs. It was quite easy to trick them into that. So we based the whole narrative on not that lack of abortion, because that's the professional talk, like lack of abortion is dangerous and it's against human rights and so on and so on. We say this is stupid. This is really stupid, because that was the general feeling in the mainstream that didn't have a stance. Like me, I didn't have a stance on abortion before 2016 because I lived in the ban and I just didn't know anything else. The first feeling was, this is stupid. This is just absurd what we're living at. And we still build on that because this is what's convincing to people. Like we have this whole system that should go away because it's stupid, it's absurd, and it really gets to young people especially. That's simple. This is our experience besides everything else, I think.
I think that's so important. When you're so accustomed to jargon and language, you can't hear yourself anymore. And you have to have somebody help you to break that down or say it in a way that just makes sense to them. And just by flat out just calling it stupid and saying that we need to just look at women, listen to women, and frame it from that perspective, that breaks through, I think, a lot of the sort of nonsense that comes forward and that we all have to sort of push through to get to the actual facts of what's needed here. And so I want to turn to Veni, but I'm going to add a second question that came through to yours, Veni, as well, if you can answer quickly as well. We had a colleague who asked if Women on Web is able to provide services in Hungary, where access to abortion is also banned and highly restricted. So you have two questions.
Okay, I'll start with the most recent one. So yes, Women on Web service is also available in Hungary, and we have a Hungarian help desk responding to messages from Hungary 7 days a week, and we've been there for quite some time already. But over to the other question around advocacy, we try to root our advocacy in optimism. So when we think about 17 years ago when Women on Web was set up, telemedicine was such a controversial concept. Everybody thought that Dr. Rebecca Gompertz, our founder, was was taking a risk, this is impossible, and here we are 70 years later. And I think that's what we want to continue doing, being optimistic, continue to imagine a radically different reality for abortion. So we've started to talk about over-the-counter access to abortion pills, for example. We've set up a service where people can request abortion pills before they are pregnant. So to start really reframing what abortion access looks like, and really bringing the allowing people to have abortions on their own terms. So I think optimism is really important, especially right now when we're witnessing such enormous setbacks of women's rights in certain countries as well. And another thing that our advocacy is really rooted in is research. So we've been publishing a lot of research around our own service outcomes, but on telemedicine and self-managed abortions in general as well. And that's important. Like, data is 100% on our side, and there's going to be a time when it's going to be hard to ignore all that large body of evidence that's now saying that telemedicine and medical abortions are indeed effective and valued and safe.
Great, thank you. So the last word is over to you, Mal, for this round.
Thanks a lot. And it's great to hear of all the different experiences that is actually working and actually seeing how the different contexts that we have to work within. And Marta, maybe I agree, but maybe at the same time, it's not always possible to deal with it with the way you're actually focusing on within your context. And I think that's something else that we actually have to take in consideration. Call it stupid, call it what you may, but in certain contexts, the only way that you could deal with working for such a subject as a sexual reproductive health and right is actually providing evidence on unsafe abortion, and that actually making it clear that regardless of the restrictions, regardless of the conservatism or the religious beliefs and so forth and so on, people are going to have abortion, and this is what we have to have statistics for and actually bring the light to. So for us in our context, the narratives are actually highlighting the unsafe abortions that are actually happening. And this actually brings that inevitably that if people are having unsafe abortions, that the need to have access to safe abortion services within the country. So for us, within our context, is actually where we're dealing with it. We actually have also leading a coalition for the prevention of unsafe abortion. And that's the only way to deal with it. Even with this context, as our colleague Bing also mentioned, the word abortion in any context, anyway, unsafe, safe, anyway, in Palestine right now, women's rights in general are actually being opposed to women's health rights, even more so. So you could just imagine of the difficulty of how you have to be quite sensitive to the context that we're working within. And it may be baby steps, but even to advocate for safe abortion in cases of rape or incest or what may. This is actually something that if we could reach that, we would be actually going forward. So I think it's just, it's quite interesting to see the different progresses of what some contexts in some countries how the progress is being taken, and in others of actually how you have to address the topic as well.
I think that's a great point, Amal, and that's the power of having such an international panel, is that we can bring that context and the specifics where we're all working. Every country, every community is on its own trajectory and its own path toward change, and it's not always linear, but we can learn from one another and be inspired by one another. And I think that's how we'd like to end this webinar in the 15 minutes that are remaining. Again, we're grateful to ICFP for inviting this conversation and this partnership with IPPF to the in-person meeting in Thailand in less than 2 months' time, where we will have a similar panel discussion with another range of colleagues to bring this conversation forward and into the heart of that conference. And as I mentioned at the outset, we would like to end that with a call to action. on how we as a collective community will push forward sexual and reproductive health and rights and justice, and specifically for access to abortion as well. And so you all have the opportunity to be the first people to help us frame that call to action. And I'd like to end this webinar with your words. What would you like that conversation to look like? What would you like to be included in that call to action? What are the specific perspectives and actions that we can take at all levels, from service delivery to movements to government policy and legal actions? And so we can end this on that platform of power, that we know there's opposition. That is as it ever was. That's not changed. Their organization has gotten stronger together, but so is ours. And you all are the counter narrative. Your lived experience, your work, your dedication shows that we can make progress person by person, and that we will continue to do that regardless of what opposition comes our way. So we'll go in the order of the original panel. So Pame, sorry that you get to go first, but you do so brilliantly. We'll go Pame and then Nelly, Amal, Bing, Marta, and Veni. What is your call to action for the International Conference on Family Planning? Pamela, over to you.
Gracias. Bueno, el llamado a la acción para mí es continuar construyendo y fortaleciendo los movimientos feministas de distintas maneras, ¿no? En estas estrategias de narrativas, de poder trabajar frente a estos grupos opositores antiderechos que son muy fuertes. Voy a insistir con la inversión en los movimientos feministas, en estos espacios multiculturales y de distintas latitudes del mundo que nos enriquecen y que nos ayudan a conocer otras estrategias y a poder adaptarlas y trabajarlas en nuestros contextos en pos de lo que venimos hablando durante toda la jornada, que es esta autonomía corporal. Entonces, la invitación a llegar a la conferencia con estas ideas y con este trabajo conjunto y poder conversar más sobre aborto en espacios como esta conferencia. Gracias.
Thank you. Talking openly. Nelly, over to you.
Thank you so much, Beth. So for me, my call to action will be, I want to, so for me, my call to action will be, I want investors to invest in locally led intersectional movements that are globally connected and have a human rights approach.
I want that too. That's well said. Great. Amal?
Yeah, I think we're all kind of sticking to the same aspect of the global approach. So I also would have, my call would be to actually work together as globally and as all stakeholders, as women, as UN agencies, as NGOs, governments, and so forth and so on, that to ensure that all women's health, sexual reproductive health and rights are protected, are respected, and that we can have accessibility to services with dignity, regardless of where we are in the world.
Thank you so much. I think that aspect of dignity should be foundational to all of our efforts. I know it is critical in all of your work as well. So next, Bing.
Yes, today we are mobilizing, and I think it is also, fitting to say that collective action can transform power, and this is what we are doing right now. And it is true in every aspects that we've shared today, that strengthening grassroots and youth leadership to challenge restrictions is not impossible. Those are not impossible. only if, the grassroots activism are supported for them to be able to take the positive action, to seek accountability, and to advance safe abortion rights. My call is that it is necessary that these movement-led initiatives are provided with technical support and financial resources to be able to ensure that the gains that we already had are sustained, it can be scaled up, and so that there'll be no more regressions. And that's my hope. There's no more regulations, there's no more restrictions and criminalizations of abortion. And at the conference, I hope to hear more about the strategies and funding support, because after all, it is our own body, it is our narrative, it is our right to bodily autonomy. Our body should not be subjected to political debates and policies of the few.
Yeah, thank you so much. And I think it's so important that everybody so far, not saying that the next speakers have to include this, but the common thread throughout this entire webinar is that advocacy is critical, that services obviously are the foundation, but if we don't have continued advocacy and support for an investment in it, then whatever progress we made is always going to be even that much more fragile, because we know that there's no place where we've sort of won access, where we've won a level for women that doesn't continue to be vulnerable. I mean, we see this in political elections just this last week in Sweden and in Italy as well. So all of us have to continue to push on that investment for advocacy. And Bing, you said earlier, persist, resist, and come together. And maybe we call that can be our subtext for our call to action. So Marta, over to you for your words of wisdom.
One practical, because I think most of said, this is the scarf that we are actually using. I don't know if you can see that. And this is important. We did it for hours. So my dream is actually that we start using the green all over the world, because I don't see any point in inventing things that were invented and are brilliant, and it worked in Poland, and we should be using the green. And I understand that in some countries there's a whole discussion. Some countries have better organized organizations, better established organizations, and there's this whole ego ambition thing. Let's just stop that, because the green is okay, and the green is known to the people outside of the bubble. This happened in Poland, and it's happening everywhere. So my dream is that we're all wearing the scarves at some point, and that we have this like map in our head where the abortion fight is, and we make it like a global color, global symbol, global narrative. That's what we should be doing, I think. And of course, I cannot impose that, because I know that everywhere situation is complicated, and every organization has their own. We also have a logo, but we managed to modify it. We use it proper way to do the abortion campaign in Poland. And I will be encouraging people, and I will be encouraging everyone to do that, in spite of all the narratives and visuals and whatever handbooks we have, because this is the global campaign that we can do, and we can base on all the wins in Latin America, like we do. We're in Poland. We have actually, we had young people changing part of Polish national anthem to put Argentina in it, to put the word Argentina, that they show us how to win. This is this. And that's what I'm thinking. This is the practical side, because I agree with everything else. And of course we should do that. But I think we have already the 30% of the visual and narrative work done about abortion. And this is the green color, and these are the green scarves. And I know this is just scarves and this is just color, but believe me, it works. I believe it works really. Let's try to do that, like overcome the other things and ideas that we have, because I would love that. Like if we meet in a year, we all will be wearing them. I would like to see that.
I would like to see that too. I think that's a great call. And we can certainly do that for ICFP as well. And make sure that while we're there to learn and support around access to contraception, that we're all seeing this agenda as so much broader.
Yes,
and that the inspiration that comes from Latin America can
imagine parliamentarians, journalists in different countries, like people from outside of the bubble, wearing the scarves. Like when we make it a global thing, when we make it in our countries, it can actually work. I really like that. Let's try that.
I like that too. Veni, final word over to you.
It's so inspiring to hear everybody's calls to action. I guess our call to action is to continue to have just radical trust in women, a radical trust in the abortion pill, radical trust that people can make their own decisions around their abortions, whether it's self-management, whether it's in-clinic care. And something I already said earlier is that we need to stay optimistic. The abortion pills are truly in our hands, and we're not going to give that power away. We have what we need. We need information, we have delivery systems, we have international solidarity, and we have these collectives and communities who are stepping to provide care and support every day. And these are the important aspects that need to continue to be strengthened and protected. And yeah, let's continue abortion dreaming. Let's continue dreaming about that radically different reality for abortions, even when faced with all this opposition.
Thank you so much. And I know that we have this recording and we'll be going back over that to pull out the really critical threads that you've said, in addition to, and I love that, the radical trust in women. It's still shocking that in the world we have to ask for that, but I think that we demand it now, and that the time for asking can be over in some places, and that we have to start demanding, recognizing again, the trajectory is long and we're all living and working in different contexts, and we need to be respectful of that, but that the goal is exactly that radical trust in women, and that we have green all over the world. Again, we persist, resist, and come together. We invest in locally led intersectional movements for radical change, and that we strengthen feminist movements with the ultimate goal of being bodily autonomy and the opportunity for women and all people to make decisions for their own lives that are respected and dignified. So I want to thank our panelists today for coming together, and for your optimism, for your words of encouragement, and for the recognition that we are doing this important work in countries around the world. Regardless of legal context, we work within the frameworks that we have for that kind of radical change for the future, and that we're able to bring this conversation to the ICFP conference is an honor for all of us together to share and to work with our colleagues who will be taking the next phase of this conversation forward into that in-person conference that we look forward to in a few weeks' time. So thank you again to our panelists for your dedication and your contributions today. It's incredibly powerful that we're here collectively, and that we have a global audience that's part of this conversation with us. I want to thank again the Conference on Family Planning for their collaboration and their partnership. Thank my colleagues at the International Planned Parenthood Federation, IPPF, and thanks as well to our audience for attending this webinar and for your engagement during the conversation. Thank you for marking today the International Day of Safe Abortion together in collectivist feminist spirit as we work for one another and for our own communities around the world. Be well, be safe, take care of yourselves, and we look forward to seeing those of you who will be with us in Pattaya, Thailand in November. Thank you, everybody, and goodbye.
Bye. Thank you.
Bye.